All right, good afternoon. My name is Caroline Stevens. I'm a student at Southern New Hampshire University. I am going to be completing the adult physical assessment, a portion of a complete health assessment for my nursing assessment class, Nursing 325. I will first show that I am maintaining my integrity by having a clear workspace and room for the assessment, a 360 view of my workspace. Let me get that propped back up where you have clear view. This is Mr. S. He has agreed to volunteer for the physical assessment portion, and we are going to get started. Let me step away and wash my hands right quick. I'm going to use some hand sanitizer. All right. Validate that Mr. Stevens is volunteering for this assessment. Is that correct?
Correct.
Can you give me your date of birth?
18 May 64.
Thank you, sir. All right, we're going to get started by doing skin, hair, and nail assessment. It will be a quick head-to-toe assessment. We're going to start with a visual inspection of your skin. We're just going to check the arms. We're going to check the legs. All that looks good. There's everything within normal, no abnormalities seen. I'm going to let you set up good for me. We're going to check the head. We're going to check the symmetry of the head. All that looks good. There's no masses, nothing abnormal there. I'm also going to take the opportunity to look at your nails, shape of your nails, nail beds, and your toenails. If you had your shoes off, we would take care of that. They look symmetrical. There's no cracking. No evidence of any type of fungal infections or anything that's abnormal there. We're also going to check the hairline for any unsymmetrical hair growth or any rashes or skin abnormalities in that area. He is African American male with a little darker skin tone, but nothing that visually appears to be abnormal for his race. We're also going to, at this point, take an opportunity to check turgor and any signs of just generalized edema. You can do that in various places on the body. We're going to use the back of the hand. You're going to pull the skin up. You're going to give it a few seconds to return to normal. His was very brisk and well within the normal range or expectations. Next, we're going to turn that just a touch. We're going to start with eyes, ears, nose, and throat. We're going to first look at the eyes. We're going to check for symmetry in the eyes. We're going to check for any type of masses, bulges, abnormalities, any type of redness, discharge, drainage, anything that would be abnormal. Everything here is fine. Eyes are set symmetrically. There's no obvious bulging or malformations. We're going to palpate the lower eyelid area as well as the top eyelid area. We're checking for, again, edema, masses, anything that would be abnormal. We're also going to check hair and hairline of the eyebrows, spatial distancing of the ears. We're going to check jawline and face. Very good. While I have you here in this position, I'll go ahead and check for TMJ. Let me get you to open and close your mouth for me. Thanks, sir, and close. Any pain or tenderness when you do that?
Yeah.
All right. Looking again at the eyes, we're going to check a visual assessment. I'm going to check real quick for the reaction to light. Call this PERLA, or your pupillary response to light. I'm going to cover one eye. You just keep looking at my nose. Pupillary response is brisk. Pupils themselves are about a 2. Equal and reactive. They accommodate the light well. All right. Then we're going to continue on the face itself. We're going to check nose. We're going to check mouth. We'll check the neckline itself. I'm going to take a look at your nose. It's symmetrical. There's no evidence of prior injury. There's no bleeding, drainage, or discharge. The nares themselves are equally in proportion. I'm going to close one side and let you breathe normally. You let me know if you have any difficulty with that. In exchange of air, there is good airflow on the right and the left. Very good. We're going to check your ears. The ears look good. They're symmetrical. There's no drainage. There's no redness, no edema. Nothing looks abnormal. I'm going to whisper a word in your ear. We'll start with the right, and then I want you to just repeat back to me what I say.
Here. There.
Very good. Any problems with that?
No.
Any drainage that you've noticed? Any pain in this area?
No.
Everything is nice and symmetrical. While I'm here, I'm checking lymph nodes, palpating down the neck. I've got nothing there. The tonsils, you've had a tonsillectomy.
Yes.
Clavicle lymph nodes are good. Under the armpits into this area to check lymph nodes. And all that is within expectation. Thank you. Okay, so next we're going to move on down the body. And some portion we may come back and forth doing a couple of things, being sure that we get everything assessed that we need to get assessed. We're going to go to respiratory now. And what I want you to do is be sure that you take good, even breaths. And when I need you to take a deep breath, I'll let you know that I need a deep breath. And there are a few other things I'm going to let you know to do as we're conducting this portion of the exam. Nothing that I think that, you shouldn't have any problems with. I know that you have a history of asthma, so if you need to breathe or take some extra breaths in between, you just let me know or stop me or let me know that you can't complete it.
Okay.
All right, I want you to take it just a normal deep breath for me. Everything visually inspected here looks good. I want you to turn just kind of to the side. I want to get to the back a little easier. All of this looks nice and symmetrical. Take a nice, even, deep breath for me, in and out. Very good. No evidence of any tactile freeness. I'm going to listen now to your breath sounds. Start with the front right. I'm going to take a deep breath for me, in and out. The left. Right lower. Left. Left. Very good. Nice, even in and out breath, symmetrical and clear. Let's start again with this right side in the back. Deep breath. Left side. Left. Left lower. One more time. And again to the lower. Very good. Now we're going to do a little something different. I'm going to go back through this again, and I want you to say the word 99 when you're taking these deep breaths in and out. Just 99. Inhale and 99 for me. You just do that repetitively. I'm going to take a listen. Go ahead.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Very good. Being sure that we listen to at least 5 lung spaces anteriorly and at least 7 to 9 posteriorly to be sure that we don't miss anything. Lungs sound good and clear. Equal and bilateral, symmetrical rise and fall. We're also going to now percuss this area, checking for dullness over the lung fields themselves with the exchange of air. If there's something that is impeding that, like a mass or say some fluid building up, you won't have a good tamponade sound, or when I do this percussion, it'll sound very dull or muffled, and you don't want that sound. So I'm going to do this. We're going to compare right to left again. You're going to feel me tapping on you. If this hurts or causes you any discomfort during this, you just let me know and we'll stop. Right side. Tickle you just a little bit. You got good sensation. That's good. All right, that all sounds pretty good. Let me see if I need to adjust this a little bit. Making sure that they can see front to back. There we go. All right, we're going to be sure that we have listened, we have inspected, we have percussed, we've palpated, we've auscultated. Don't see anything in the chest area abnormal respiratory wise. Now we're going to do your cardiac assessment. I'm going to listen to pulses. I'm also going to check for circulation and anything related to the heart. Also listening for abnormal heart sounds or murmurs. With the heart, we're going to first check for what we call PMI. It's going to be a mitral area pulse, so I can get a baseline or listen clearly to what I am going to compare all the other pulses to. So again, we're going to check pulses. We're going to check for any type of enlargement here in the carotids or jugular vein distension. Those are nice and equal and symmetrical bilaterally. No evidence of that. I'm going to get you, if you can, this may be a little difficult to achieve, lay on your left side. If you can, I want you to kind of raise that arm up and stretch out.
The left arm.
Left arm, if you can, just like that. If you can. We won't be in this position very long. Let me come around. I'm going to listen. Left side. PMI. Fifth intercostal space, about midline. That sounds good. Okay, now you can sit up. I know that's an awkward position for you. All right, we're going to listen now at your pulses. I'm actually truly going to stop and pick up here at the top. We'll do a temporal comparison. We're going to do carotid. Nice, even carotid. +2, maybe +3. I'm going to check brachial. Nice and equal right to left. Radial. See, at this point we can do renal, about 3 centimeters up abdominally, right and left side. And then we'll check femoral arteries, right and left side. Very good. We're going to check popliteal, that's right behind the knees. Tibial. And we will assume that your dorsalis pedis will be equal as well. All +2 to 3 equal and symmetrical sounds. All right, we're going to move on. Hopefully, maybe you can see we did cardiac, respiratory, GI. I think you'll be fine there. We might move it a little closer. All right, we're going to first, I'm going to assess and inspect the symmetry of the abdomen, looking for any masses or bulges or lumps or masses. Then we're going to listen. We're going to palpate again, just like we did earlier. I'm also going to percuss, again, listening for any type of dullness or anything that may be abnormalities that we may need to investigate a little further. Have you had any pain or any tenderness in the abdomen? Everything is nice and symmetrical. Everything is even. Inspection-wise, looks good. All right, we're going to percuss first, and then we will auscultate. So when you percuss, again, just like we did with the lungs, we're going to be using a pattern so we can do documentation and comparison. We're going to do right lower quadrant first. We're going to do left. And clockwise motion. You want to be sure when you do this that you, again, hear a very clear sound, nothing dull or muffled. We would do this, obviously, laying flat would be better, but everything seems to be in order. We're going to auscultate your vowel sounds. You're going to listen to these, each quadrant, all 4 quadrants, for at least 30 seconds. We're going to do right lower quadrant first. Right upper quadrant. Left upper. Left lower. Your midline, I'll see if I can hear your aorta. And a corner of this left lower upper corner here. Very good. All that seems to be in order. Now we'll palpate. Is there been any tenderness, any pain? Do you feel anything abnormal when I lightly palpate in these areas?
No.
Right. Okay, so after we do GI, we're going to do musculoskeletal. This is going to require you to do a little more movement. We're going to be checking range of motion and strength. First, we'll do just a general inspection of the joints, checking for any type of abnormalities like edema, even signs of inflammation like redness, again, swelling, anything that looks like a deformed joint, anything out of place. Everything looks to be symmetrical and as expected. Then we're going to check each area for range of motion and strength, working head to toe. We'll start with your head. Again, we're checking for symmetry while we're looking and inspecting, continuously assessing as we're going through the process. Everything looks to be symmetrical. What I'm going to get you to do is a series of movements to check your range of motion. I want you to touch your chin to your chest for me. Very good. Look back up. Now I want you to look up at the ceiling for me. Very good. Look back at me. Now just turn head side to side. Go right to left, if you will. Very good. Now, if you can, touch your ear to your shoulder. Let's see how that does. If you have any pain or discomfort, you let me know. I see you kind of favored that a little bit. Let's go left shoulder. Same thing on that side. That's okay. That's okay. You can move. So we do have a reasonable range of motion. We're also going to check strength of each of these joint areas and the movement itself of the muscles. So what I want you to do is I want you, again, to move your head down. I'm going to put a little resistance here under your chin. Still very good. I'm going to do the back of the head with a little resistance. Still very good. And then we're just going to do the head side to side. I want you to just turn your head this direction for me. I'm going to, yeah. And now see if you can move my head at the end. All right. Very good. Very good. Now I'm going to get you to shrug your shoulders for me. Shrug up. There you go. Now can you put your arms out in front of you? Can you extend them out just a little bit and put them back down to your side? Very good. Any pain or discomfort in that area?
No.
Okay. Now we'll do your arms. We're just going to have, again, put it out from the body, put them down to the body. I'm going to try to do a little resistance here. I myself have some upper body issues going on, so I'll try. You give me a little push out or see if I can hold you.
Both of them?
Yes, same time. Okay, that's very good. That's very good. All right, now we're going to do the elbows. Again, put your hands out in front of you like that. And then palms up for me. Very good. Very good supination. Rotate them back down for punish. Very good. Bend them back up for me. Palms up towards them. Now I want you to pull your elbow up just like that. Very good. Now I'm going to try to resist. You pull. Very good. Very good. Other way. Put it down. Try to push down to you. There you go. We're going to do this arm. Pull towards you. Very good. And pull down towards your body. Very good. Good resistance. All right, now I want you to take my hands, squeeze my hands. Very good, nice and equal. Very good grip. Relax for me. All right, so we've done neck, shoulders, elbows. We're going to come down to the hands and wrists now. If you will, put your hands back out in front of you. Comfortable position. That looks good. Rotate them flat like this for me. Now, again, what I want you to do is rotate them up and down. Very good. Now I want you to take your hands like you're going to stop me. Just like that. And now down towards the floor. Very good. Now put your hands, right position again. See if you can bend your elbow. You're just at the wrist. Your thumb towards your body. And now out away from your body. Very good. Excellent. Excellent. All right, now I'm going to try to do my best to keep you from pushing your hands down. Push them down towards the floor. just at the wrist. Can you bend at the wrist? Very good. Now see if you can do the stop motion again. Can you push your fingers up? Very good. All right, relax for me. All right, now it's going to get a little more complicated for you, so you let me know if you can tolerate it. We're going to check your spine. So I'm going to let you stand up for me. I'm going to step kind of back to the side here. I want you to lean forward as you can tolerate it. Give me a little bit of a flexion. There we go. All right, straighten back up. And then we're going to extend, flex back. There you go. Very good. Extension looks great. Don't want you hurting yourself. Now, if you can, I want you to twist just the upper body at the waist. See if you can do a side to side for me. There you go. Twisting around. Now, see if you can do one side and the other side. One side and the other side. Very good. Very good. All right, now we're going to look at your hips now. Have a seat on the bed for me. Perfect. Those hips look like they're working pretty good. Now I'm going to get you to raise your right knee and then raise your left knee, bringing your foot up off the floor for me. Very good. Place it back. Left knee. Place it back. I'm going to give you a little resistance here. Try that again. Okay. Left knee. Very good. Now we're going to look at these knees. I want you to kick your foot forward and straighten that leg out for me. Very good. Place it back down on the floor. Left knee and back down on the floor. Very good. Now, kick that leg back out again. Very good. And now a little resistance here. Pull it back in. Very good. This one. Back in. Very good. And down. All right, now we're going to look at your ankles. Your ankles look like they may be a little swollen bilaterally today. I'm going to see if I can get down here with you. Here we go. That one may be a little slow. You may have a little difficulty with the left one, but we'll see what we can do. All right, so at this point in time, we're going to look at the range of motion in the ankles. What I want you to do is take your foot, bring your toes up to your knee. Very good. And then point it straight out. Very good. Then I also want you to take the same foot, if you can, and rotate it in and rotate it out. Do the left one for me. And down, and in, and out. Oh, there you go. That might feel a little better. All right, now we're going to do it again, but I'm going to hold a little resistance for you to dorsiflex and plantar flex each foot. That's going to be up and down. So let's do the right one first. Pull it up. Very good. Push it down. Very good. Now we'll do the left one. Bring it up. And the left one. There you go. Very good, very good. Well, that completes the range of motion. Now for motor skills, we have a few more things for you to do. Might be a little more challenging. We'll challenge some of your coordination possibly. But we will see if we can work that out as well. So if you will sit back to the other side of that little rug there and just walk comfortably, heel to toe in my direction. Very good. That's good. Now, if you can stand up on your tiptoes and walk on your tiptoes a few steps. If you can, like you're going to tiptoe through the wet grass. All right. Now, can you do that on your heels?
Backwards or
If
forward?
you can, doesn't matter. Whatever is comfortable. I just want to see if you can put some weight, and there you go, and move well on those joints. All right. Now we're going to sit down for just a minute. I'm going to check to see if you can actually do a couple of movements simultaneously and how coordinated you are. You'll have a seat back on the bed for me. Any pain or discomfort with any of that?
No.
All right. So what I want you to do at this point in time is I want you to look at my finger, and I want you to take your right hand and touch my finger. There you go. And take your left hand and touch my finger. Now take your finger, your right finger, touch my finger, touch your nose. There you go. Now left hand for me. Very good. Okay. You're going to keep going. That's fine. That's fine. All right. Let's see if we can get the neuro done. That's part of that coordination. I'm going to pull this forward just a touch so they can see your face a little better. Okay, so we're going to look at nerves, the facial nerves mostly is what we're targeting. We're going to look at facial nerve number 5. It's going to check your jawline, symmetry, teeth clenching, that sort of thing. So clench your teeth for me. Show you clench them really good. Excellent. Now relax for me. Now I want you to slowly open your mouth and then move your jaw right to left if you can. Perfect. Any pain or discomfort in that area?
No.
Excellent. I'm also going to ask about sensory. Let me step right here. Let me turn that. I'm getting my pen. A couple of things here. Let me turn that back. All right. What I want you to do now is close your eyes for me. Let me know if you feel a sharp pinprick or if you feel a dull sensation and which cheek you feel it on. Okay?
Ow.
Mm-hmm. So was that sharp or dull?
It was the
And which cheek?
left.
Perfect. Sharp or dull?
Dull.
And where was it?
Right.
Perfect. Now we're going to do number 7. That's going to be more of the muscular facial responses. And what I want you to do is going to be a little bit of a series of things. I want you to open your eyes wide for me first. And then I want you to clench them really tight together for me. There you go. Open them again and relax. Raise your eyebrows really wide. Perfect. And relax for me. Oh, yeah. Can you wink? Perfect. All right. Then I want you to smile really big for me. Perfect. Relax for me. Now I want you to puff your cheeks out. There you go. And now can you purse your lips? Like that. Now, can you blow at my finger like you're blowing out a candle? Perfect. Excellent. Now say ah for me.
Ah.
Stick your tongue out. Big and wide. Ah. Perfect. Now, at this point, if I was also checking for gag reflex, what I would do is actually touch the back of your throat, see if you have a gag response. I'm not going to do that to you because you're wide awake and talking to me, so that should be all normal. All right, now we're going to move from neuro and muscular to sensory. This might get a little more complicated. You do have some clothing on, but we are going to check your sensory response. So what I'd like you to do is close your eyes. I'm going to go through a series of pinpricks and dull sensations, and I need you to identify to me if it's dull, if it's sharp, if it's very soft, if it's very light, any word that you want to use to describe it. We're going to do right to left so I can compare your ability to sense what I'm doing, okay? So close your eyes. You let me know, is this sensation dull or sharp?
Dull. 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 Dull.
Do you sense them evenly?
Yes.
Excellent. Now we're going to do it again. Keep your eyes closed for me.
Hey.
You feel it?
Yes, I feel it.
Is it sharp or dull?
Just sharp. You sticking me.
Good sensations.
All right, now.
Sharp or dull?
That was sharp.
Okay. All right. Now what I want you to do, if you still trust me, you should hold your hands up like that. All right. I want you to close your eyes. I'm going to write a letter in your palm. I want you to tell me what that letter is.
B. B.
Okay. Keep them closed. I'm going to put an object in each hand, and I want you to identify what that object is. You can feel it. You can move just this hand. Tell me what that is.
A coin.
All right. I'm going to do another object. Might have to feel that one a minute longer to determine what it is.
Pen. The pen.
Very
Do I
good.
get to stick you back?
No, not today. All right, we're going to do it again. Right hand
Pen.
and left hand.
Coin.
Very good. All right, you can open your eyes now. Okay, real quick, we're going to run through some psychiatric or orientation questions. Can you tell me your initials again?
A.S.
You tell me the date.
The 9th of October.
Excellent. What day is it today?
Saturday.
And what's on TV?
Football.
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 Football. Okay, I have a couple more tests for you real quick. We're finishing it up. Which is this. You follow the directions for me, please. Very good. Quick memory test. What did you do on your last birthday?
Drink.
Okay. Fair enough. Fair enough. I have a challenge for you. I'm going to ask you now to count backwards by fives, starting at 100. So it'll be 100, 95, 90. Try your very best. We're only going to go for about a minute.
100, 95, 90, 85, 80, 75, 70.
Halfway. You can do it. 65, 60.
60, 55, 50, 45, 40, 35, 30, 25, 20,
So close.
50, 10, 5, 0.
Perfect. Perfect. Excellent. Okay, now we're going to check short-term memory, which for some is a problem.
Yes, it
So
is.
I'm going to say in your ear, I'm going to give you 4 words to remember. Then I want you to start at 20, counting backwards to 0, and then give me the 4 words. Repeat them back to me.
Well, repeat that again.
Okay, I'm going to tell you 4 words.
4 words.
Then I want you to count backwards from 20, and then say the 4 words. You got this. Are you ready? Okay. 4 words. Football. Truck. Florida. Cat.
Okay.
Now start at 20. Count to 0.
20, 0.
One number at a time. One number at a time. 20.
By 10s or by 5s?
No, just backwards. 20, 19,
20,
18.
19, 18, 17, 16, 15, 15, 13, 12, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Now, do you remember the 4 words?
Football, Florida, truck, cat.
Yes, very good. Excellent. We're going to go back. We did skip a few things. I'm going to listen to your heart sounds. We did talk about the heart. I listened and palpated the pulses, but I want to check the actual heart itself. So I just want you to breathe normally. I'm going to listen. First, I'm going to listen to the aortic area. That's about the second intercostal space, just to the right of the sternal area. Pulmonic, again, about second intercostal space to the left. Third intercostal space is where we'll find Erb's point. It is probably the best point to hear the S1, S2. Very good. About the fourth intercostal space is where we're going to find the tricuspid valve. Nice and regular. And the mitral valve. Fifth intercostal space, midline. Nice and regular. We're going to turn the stethoscope over to the bell side, and we can listen for murmurs or any anomalies in those same areas. Those all sound normal. Very good. All right, Mr. Stevens, I think we've completed everything. We worked head to toe. We did eyes, ears, nose, throat. We checked your skin, hair, and nails. Oh, I know one thing that we missed on the nose. We need to check your sense of smell. We checked the airflow. That was all nice and normal. So what I want you to do real quick is I'm going to give you 2 scents to smell. I am going to have you close your eyes. It's a bit of a test. Let you smell them, and then you identify for me what it is that you're smelling. Let me get those. I'm going to step right here. Grab both of those. Okay, keep your eyes closed. Smell for me. Identify what that smell is.
Stinky.
Ooh.
Vinegar.
Vinegar, yes, that's correct. And I got one more for you. Keep those eyes closed. Ooh, do you know what that is?
Garlic.
That's garlic. Yes, very good, very good. Okay, well, we have completed, I believe, all of the assessments. We've done neuromuscular, neuromotor, psychiatric, and I thank you very much for participating.
Thank you for having me.